Hello everybody! Have you ever heard of an inherited condition called Glucose6Phosphate Dehydrogenase Deficiency? It is also known as G6PD Deficiency in short, or FAVism. When taking certain drugs or foods such as fava beans or in contact with mothballs, people with G6PD deficiency will develop acute hemolysis, that is, sudden damage of the red blood cells. In view of this, the Department of Health provides a newborn screening program for G6PD deficiency in order to find it out early and prevent health problems caused by damage of the red blood cells. The Genetic Screening Unit of the Clinical Genetic Service under the Department of Health performs screening tests for babies born in hospitals under the Hospital Authority by testing the umbilical cord blood. For those babies born in private hospitals, parents can consult their private hospitals, obstetricians or pediatricians for further information. Let us learn more about this condition by watching how a nurse counsels a couple with a G6PD deficient baby. Hello, this is Nurse Tong calling from the Genetic Screening Unit of the Department of Health. May I speak to Mrs. Au, please?
Speaking. What's up?
Mrs. Au, congratulations on your new baby. Do you remember the hospital has taken some umbilical cord blood from your baby for testing? Now we've got the results. Your baby is confirmed to have Glucose6Phosphate Dehydrogenase Deficiency, a condition commonly called G6PD Deficiency or FAVism.
Oh, never. What's the problem with my baby? Is it serious?
Oh, please don't get too worried.
Nurse Tong, could you explain a bit more about it?
Sure. G6PD deficiency is the most common inherited metabolic disease in Hong Kong. It is also very common in southern China. People with this disease do not have enough amount of an enzyme called G6PD in their red blood cells. This enzyme helps to keep red blood cells stable. Most affected people do not have any symptoms. When they are exposed to some Chinese or Western medicine, mothballs, or have serious infection, their red blood cells may be damaged in a large scale within a very short time. If this happens, large amount of hemoglobin will be broken down into excessive bilirubin, a pigment. This in turn overloads the liver and results in severe jaundice, that is, yellowing of the skin and the eyes.
It sounds serious. What can I do for my baby?
Try not to be too frightened. In fact, such a rapid breakdown of red blood cells can be prevented. People with G6PD deficiency usually enjoy good health if they avoid exposing to certain triggers.
So, Nurse Tong, what should I do?
Starting from today, you have to observe for any jaundice, that is, yellowing of skin of your baby. Newborn babies usually develop some degree of jaundice on 3 to 5 days after birth. This will gradually go away without affecting the health of the baby. On the other hand, if a baby with G6PD deficiency is exposed to certain triggers that caused breakdown of the red blood cells, the jaundice may appear on the first day after birth or at a later time. Moreover, the jaundice may persist or even get worse.
What will happen to babies if jaundice persists and get worse?
Just as I've mentioned, breaking down of the red blood cells produce a lot of bilirubin. This pigment can enter the brain of a newborn baby, causing long-term brain damage like hearing loss, limb movement disorder, and intellectual impairment, etc. However, with early detection and treatment, the jaundice can be controlled effectively. So, please do arrange an appointment with the Maternal and Child Health Center as soon as possible to follow up your baby's jaundice.
So, apart from jaundice, are there other symptoms I have to take note of?
The major symptoms include yellowing of the white of the eyes and dark-colored urine. Besides, the baby may appear overtly tired and sleepy. Older children may look pale and extremely tired. They may also complain of difficulty in breathing and heart beating rapidly. If the above symptoms are observed, you should consult the doctor immediately.
Just now you've mentioned that our baby should avoid exposing to certain triggers. So what are these triggers?
It's a very good question. People with G6PD deficiency should remember to avoid the following things for their whole life. Firstly, avoid the following Chinese herbal medicines such as Rhizoma corpidis, Calculus bovis, Flos chimonanti picosus, Flos loniceri, and Margaritas. Secondly, Western medicines such as certain antibiotics and antimalarials, aspirin group antipyretics, if used in high dose, should be avoided as well. To make it simple, all medicines should be prescribed by doctors in order to avoid taking those drugs which can trigger red blood cell damage. Thirdly, for foodstuff, don't let your baby eat fava beans, that is, broad beans, or their products, such as fava pastry. Lastly, for household products, avoid your baby in contact with mothballs or naphthalene-containing products. The above information is listed on the G6PD Deficiency card, also known as Green Card, and the leaflet on G6PD Deficiency, produced by the Department of Health. Please keep this handy green card with you all the time.
Nurse Tang, we haven't got the green card yet. How can I get it?
Don't worry. If you haven't received it from your hospital, we will post it to you in a few days. Finally, remember to show this green card to your doctor and inform him your baby has G6PD deficiency. Do you have any other questions?
Not now, thanks.
Should you have any other questions, you can call our hotline 2361-9979 or ask the nursing staff or medical staff in the maternal and child health centres.
Mummy, I've followed Nurse Tong's advice and removed all the food and products our baby should avoid, like that Flos lonicerae and margaritas we've bought before. The mothballs inside our wardrobes have also been removed. I've also reminded Grandma, Grandpa and the maid not to use mothballs anymore. Oh, how about that Bo Ying Tan and insecticide? Should we dispose of them as well?
Let's ask the nurse in the maternal and child health center next time.